More now on one of our top stories tonight that is just breaking. A last-ditch White House effort to get health care coverage for some of the millions of Americans kicked off of their insurance plans thanks to Obamacare. News leaking just hours ago that this administration will now urge insurers to offer bare-bone catastrophic coverage to some of the millions who have been booted off of their plans. Avik Roy is the incoming opinion editor for Forbes.com and a senior fellow at the Manhattan Institute. Explain in plain English what they're doing.
They're basically offering an exemption from Obamacare for every single American who's had their plan canceled.
So those people, what? Now that they got kicked off, they don't have insurance, they've been trying to go on healthcare.gov unsuccessfully. What are their options now?
So the White House has now issued a blog post. It's administration by blog post. They've issued a blog post saying that if you believe the marketplace option in your area is unaffordable, you can apply for this exemption and then sign up for an Obamacare-sponsored catastrophic plan. Now, there's a lot of key elements of that. So the first is, if you believe the plan in your area is unaffordable. So this is the first time the administration is admitting that a lot of the plans offered under Obamacare are unaffordable. They've never admitted that before. They've claimed that these plans are affordable. It's the Affordable Care Act, right? Mm-hmm. And the second thing is that these so-called catastrophic plans that are going to be very narrow and have very limited benefits are actually very expensive. So the Manhattan Institute analysis that we've done shows that the catastrophic plans are actually not that much cheaper and sometimes more expensive than the bronze level regular exchange plans.
So why would you want that as opposed to the bronze level?
A lot of people won't. So this is not going to actually be that helpful to most people.
This is, originally you weren't supposed to be able to get these catastrophic plans unless you were very young.
Right.
And now they've expanded it to just whatever your age is, and by the way, your money also, like your income also mattered. Now they're saying whatever your age is, and you just tell us what your income is, and we'll trust you.
You have to be under the age of 30 to qualify. Ordinarily, you have to be under the age of 30 to qualify for these catastrophic plans, and the subsidies that normally flow to low-income people do not flow to these catastrophic plans. Mm-hmm. So you're only going to go on these catastrophic plans if you're not eligible for subsidies and the plans in your area are more expensive than the catastrophic plans, which, again, for most people won't necessarily be true.
But they're still saying that anybody can self-determine, again, if they're in a hardship situation, because that's the other way to get one of these plans. If you're in a hardship situation, and you can get one of these plans now, and that's a self-report. You just tell them you're in a hardship situation.
You define whether you're in a hardship
situation. All right,
situation.
so the bottom line here is, Avik, is they're trying to dodge the news reports and the massive groundswell of people coming out in January saying, I lost my plan thanks to Obamacare, now I have no coverage, and I have some catastrophic situation that is uncovered thanks to the law, and yet is it going to work?
No, because as I said, the catastrophic plans are actually comparable in price to the bronze level plans on the exchange. So people won't actually save any money. The bronze level plans, the people who find those plans unaffordable, they're going to find the catastrophic plans under Obamacare also unaffordable, because those plans also have to cover pregnancy and maternity and all these other things.
The other thing is, the insurance risk pool upon which this entire law was based assumed that they would have healthy people in it. What they've effectively done is taken all those people who, if they go to this catastrophic program, out of those risk pools again, once again hurting the risk pool for the insurance companies, which we may say, who cares about the insurance companies, but it undermines the whole law. It increases the prices for everybody who is now in the Obamacare system.
I can tell you tonight, Megyn, the insurers are pulling their hair out. They are unbelievably exasperated. They're going nuts because precisely that point. If people exit the regular Obamacare pool into this catastrophic pool, that means that sicker people will be in the Obamacare pool. Yeah. That means the premiums in those plans will be more expensive, and they haven't priced them that way. They've priced those plans with the assumption that everyone will be in them. Right. So they will take a bath. They will lose a lot of money.
Avik, good to see you. Thanks for being here.